For the first time in 30 years, a leading pediatric group is sharing vaccine recommendations that differ from the guidance of the federal government. The American Academy of Pediatrics is strongly recommending COVID-19 shots for children between the ages of 6 months and 2 years old. It's also advising older children get vaccinated if their parents want them to be. In contrast, under the guidance of Health and Human Services Secretary Robert F. Kennedy Jr., the CDC is not recommending COVID-19 vaccines for healthy children of any age. Joining us now, Dr. Céline Gounder. She is a CBS News medical contributor and editor-at-large for public health at KFF Health News. So, Dr. Gounder, I'm a parent. I know there are a lot of parents out there. What's a parent to do? Who do they listen to? The American Academy of Pediatrics or the federal government?
Look, for decades, pediatricians and the CDC have been speaking with one voice on vaccines. And this split signals a real loss of confidence in the federal vaccine data review and recommendation process. And the concern is that political appointees, some of them who have a history of promoting vaccine disinformation, history of vaccine skepticism, that these are the folks that are now shaping vaccine policy. What you're seeing is pediatricians who felt they had no choice but to issue their own evidence-based schedule because parents do need clear science-based guidance on what they should do and that they know they can trust.
And the American Academy of Pediatrics also made a point of saying that their guidance, quote, differs from recent recommendations of the Advisory Committee on Immunization Practices of the CDC, which was overhauled this year and replaced with individuals who have a history of spreading vaccine misinformation. That's a pretty strong statement.
It is. And look, this is the first time we have ever seen vaccine recommendations, vaccine policy politicized in this way, whether that's under a Republican or a Democratic administration. And so that's really what is the outlier here, is that the process is being politicized and taken away from scientists.
And do you think a growing number of health experts or groups will soon be publicly disagreeing with the administration on guidance for other vaccines? I mean, what does this mean for things like the flu shot and, other vaccines that people, whether they're kids or otherwise, are often recommended to get?
Well, I think, first of all, with the flu shot, the recommendation remains for all children, infants over the age of 6 months of age. They should be getting a yearly flu shot. But I do think you're going to see a growing divide between what are politically driven recommendations coming out of the federal government and what is coming out of professional societies. And earlier today, a group called the Vaccine Integrity Project, which has pulled together the nation's top vaccine scientists and is also working with the professional medical societies, they did a review of all of the new evidence that has come out since the CDC last did a review of the evidence for children and infants on COVID, flu, and RSV vaccines. And that is a group that has no pharmaceutical ties, has not taken any pharmaceutical money, and that is what is informing the guidance being provided by the American Academy of Pediatrics, as well as other professional groups that will be releasing their own recommendations in the weeks to come.
And so just kind of getting back to how we started this conversation, I mean, what is your best guidance for people out there, again, whether we're talking about children and vaccinations or adults, what do people need to know and should they know as they try to navigate this schism?
Yeah, I think big picture, block out the noise and stick with what we know is science-based. And by the way, science means you try to disprove yourself and find all the reasons you might be wrong. And if you still have that evidence there backing up what your conclusions were originally, that means you're standing on pretty solid ground. And so that is where we are with the recommendations that are coming out of the American Academy of Pediatrics. This is standing on solid ground. But stick with the routine childhood immunizations we've been recommending for decades now. Stick with the recommendations that the American Academy of Pediatrics just released on the fall respiratory virus season, and you'll see more recommendations coming out from other professional societies in the weeks to come.
All right, Dr. Céline Gounder, thank you so much.